So now that you have a better understanding about what is IMT, how IMT works, how the brain works, I want to go over the main difference between IMT and other forms of therapy. And I want to highlight this because that is going to be very important and key. It will help you to decide whether or not IMT is for you. And the main first difference is the duration. IMT is such a brief model. Generally, people need between 4 to 8 sessions. Each session lasts around 3 hours roughly, and that's it. In some rare cases, someone may need 10 to 14 sessions, but this is going to be the minority. Generally, people that it needs IMT sessions with 4 to 6, 8 sessions, they don't. So the duration of IMT is quite brief. Whereas if you may are going through other forms of therapy, such as psychotherapy, CTBT, they are normally quite lengthy therapies. Generally, you will be seeing your therapist roughly for a year, maybe twice a month or weekly. IMT is brief, 4 to 8 sessions, and then you are done. The second main difference between IMT and other forms of therapy is the focus. IMT doesn't focus on talking about the problem, understanding the why, exploring. The role of your therapist is not to provide any transactional analysis. IMT is not for someone who wants a therapy that goes there and wants to talk, to feel understood, to feel listened, to feel supported, for someone who wants to look at the past and understand why. The focus of IMT is to seek change. That's it. IMT is for people who wants to change. It's for someone who wants to change the way they feel, the way they think, the way that they react to certain situations, for people who is maybe currently struggling with problems with other people, who is maybe struggling with a situation that they are facing at home, at work. Is for people who want change, because what IMT does is changing. It will change the way you feel, the way you act, and the way you think. It's for someone who is seeking change in their lives. So this is also key, because you may be someone who is currently going through grief. And I'm not saying that IMT doesn't work on grief, but maybe it's for someone who has lost someone 1-2 years ago and it has gone through a form of talking therapy. But if you are currently struggling with grief and you may be the person who is seeking someone to talk to and to feel understood and to feel listened and to feel supported and to be given maybe advice, IMT is not for you. IMT is not a talking therapy. IMT sessions are focused on change. And the way that this is achieved is by moving your eyes. Yeah? So the focus is quite different. Yeah? And another thing that I want to highlight when comparing IMT with other forms of therapy is the technique. If you go through other forms of therapy, you will go there, you will talk about what has happened and why you are struggling. Whereas with IMT, you go there, you recall that situation, memory, emotion, limiting belief that you want to change, you will be focusing on that, eliciting that problem that is stopping you to go ahead in life, and your therapist, it will be moving your eyes. So you won't be going to your therapy sessions to discuss any type of problem. So the focus is moving your eyes, processing this thing that you are finding challenging. Another thing that is very important to highlight when comparing IMT with other forms of therapy is people's feedback and difficulty. IMT is found very easy to go through because with other forms of therapy, you need to go back and you need to look back and go through certain things in your life that may be too painful. Whereas with IMT, we are not talking about that. We are processing this. And the beauty of IMT is even though you are eliciting that memory or that emotion or that limiting belief, it works for PTSD, anxiety, depression, phobias, and the list go on and on and on and on and on. It works on everything that is negative. Even it works for people who has lost their limbs. So it works for anything negative, no matter how traumatic that thing is. It can be sexual abuse, physical abuse, but the beauty is when you are focusing on that, you are already processing because you are moving your eyes and your brain is starting doing the job. So people generally find IMT session almost pain-free, emotionally pain-free, because even though you are be going through things that they have been very traumatic and close to your heart, you are gonna be already processing. And immediately after I move your eyes, the problem is gone. And that's the beauty of that. And finally, and to me, that's why I find INT so powerful and empowering, is the difference between IMT and other forms of therapy is, and to me, I found this fascinating. In another forms of therapy, your therapist is always almost like the knowledgeable, the ones who tell you what you need to do, what you have done wrong, is in a status of power. And that kind of sessions almost it make you feel like you have done something wrong, and they are telling you off and they are highlighting the things that you need to change. What I love about IMT is that this is completely different. There is no hierarchy. Your therapist is not there to provide any analysis of why, what do you need to change. The answer and the solutions, they will come from you. Because when you are focusing on that traumatic memories, limiting beliefs, emotion, anything negative that you want to work on, and are moving your eyes, you are passing that negative situation that you have in your life through the whole knowledge, skills, and abilities that you have as today. So you will be able to see why you felt that way and what do you need to do differently to change that. And the beauty and the magic of IMT is it will happen. You don't need to make any effort because it's happening to a neurological level. You change the way you see things. You change neurologically. So intrinsically and immediately, it will change the way that you behave. It will change your behavior. It will change the way you feel. And to me, this is the most important and the most empowering and the most fascinating is the fact that the client is able to find their own solutions. There is no I'm here and you are there. We are in the same level. And actually, the only thing that I am doing is enabling for you to find your own answers. And I found that so empowering because what I found after doing IMT on many people, even after the IMT sessions, is the client take ownership. And in some cases, they tell me, you know what, Ellie? I don't know if it's for IMT or because I was ready, but actually I'm doing things differently and I'm not doing things in the way that I did. It feels like the change. It feels no. The change happened within them. It's not something that the therapist is external and the therapist try to project and implement in them. Is a solution and an answer that comes from within. And to me, just because of that, I find IMT fascinating. So I hope after this video, you will get a better understanding whether or not IMT is for you compared with other forms of therapy. So just to summarize, duration, IMT is brief, method is not a talking therapy. If you are looking to feel listened and supported, maybe what do you need in this moment is a talking therapy, no IMT. Also, the easy that patients finding to go through, they don't finding re-traumatizing as other forms of therapy, and then the empowerment that the client feels because the client will find their own solutions. The therapist won't offer the solutions, the client will find them within themselves. And finally is the methodology. IMT is not a talking therapy, it's a kind of therapy that is focused on moving your eyes and processing negative memories, negative emotions, limiting beliefs, thinking patterns, and so on.